A very good morning to all the doctors and my fellow batchmates. I'm Pravinash Ramesh from MBBS Batch 25. We'll be presenting on a topic given Taenia Solium. These are my team members who helped me along with this presentation. Let's move on with the introduction. So, Taenia Solium is a cestode or a tapeworm that affects both human and pigs, and it is usually found in the world and most commonly in countries where pork is consumed frequently. And that is why it is known as a pork tapeworm, because the infection is primarily caused by consuming uncooked pork or raw pork. Moving on, let's move on with the epidemiology of Taenia Solium. So, who are mostly affected? Tapeworm infection is more prevalent in underdeveloped communities because of their poor sanitation and also at the locations where people eat raw or undercooked pork. It is also common in areas where animal husbandry practices are taking place, where pigs and cattle were grown for their meat. So what will happen there? The pigs and cattle will have come in contact with the human feces, which already with the eggs of Taenia Solium. Higher rates of illness have been seen in people in Latin America, Eastern Europe, Sub-Saharan Africa, India, and Asia. So, how many were affected? So, globally, approximately 2.8 disability adjusted life years lost. But between 2010 to 2015, almost 300,000 individuals were estimated to be infected. But from there, only 28,100 deaths occurred. There are a lot of endemic countries which for this Taenia Solium. For example, Mexico, Asia, India, South America. But the most important we're going to have a look is now is Vietnam, which is one of the endemic country. Why I'm concentrating on Vietnam is because most of the previous research done is done at in this Vietnam country at the north side. So from the research, a review has been given that common risk factors for Taenia include consuming raw or undercooked meat or vegetables, lack of functioning latrines, husbandry practices allowing pigs to free roam, and routine of use of human waste for fertilizing and irrigating crops. So these are the common risk factors given during the research. So as you can see, this is the map. So as we can see, the South America, Asia countries are the endemic countries. Moving on, morphology of Taenia Solium. So Taenia Solium have head or scolex with 4 suckers. So this is the scolex, the whole thing is a scolex, and they have 4 suckers. Then they also have rostella with 2 rows of hooks. This is the rostellum, the middle part, and they have 2 rows of hooks, which is small hooks and large hooks. They also have unsegmented narrow neck, and their large body formed by proglottids. This is proglottids. So, proglottids, when they are moving further from the scolex, they become more mature in it. So, each proglottid can contain more than 50,000 fertile eggs. So what the fertile eggs, most of the fertile eggs will be accumulated in this A position, which is the profusely branched uterus. So all the fertile eggs will be accumulated within these branches. This B is the genital pore and C is the sperm duct. Moving on to the modes of transmission, there are only 2 modes of transmission for this. One is consuming infected pork or raw pork. Another one is consuming feces that already consuming contaminated food or water that already has contact with the feces, which contains the Taenia Solium eggs. So in simple words, it's fecal oral transmission. So let's move on with the Taenia Solium life cycle. So first we describe about cysticercosis life cycle. It is infection caused in human and pigs. So what will happen when a human ingests food contaminated with the feces and eggs? So they will get infected. So the pigs and the human will ingest the food contaminated. So what will happen? The eggs will be ingested. The oncosphere hatch in the intestine. So the oncosphere will hatch in the intestine. So what will do? It will invade the intestinal wall and enters into the bloodstream, and they will migrate to multiple organs and tissue. So what will happen in the multiple organs? That's where they will mature into cysticerci. This will take approximately 60 to 70 days. Some cysticerci will migrate to the CNS, which is the brain, causing neurocysticercosis. So the cysticerci will migrate to the brain and cause a neurocysticercosis. Moving on with Taenia cyst. Taenia cyst is the infection of human with adult tapeworm. So human is the definitive host. So what happened? The eggs and the proglottids is passed in the feces. So the animal ingest, which is the pig, will consume the vegetation which already contaminated with the feces. So in the animal's intestine, the oncosphere will hatch and penetrate the intestinal wall and circulate into the muscular of the pig. So in the muscle, then it will develop into cysticerci. So the oncosphere will develop into cysticerci in the muscle. So when the undercooked pork and or raw meat is consumed by the human, they become infected. So then in the human intestine, cysticerci will develop into a tapeworm. So the adult tapeworm will attach to the small intestine by their scolex and will reside there for many years. The proglottids that are being produced, so the more further the proglottids from the scolex, the more mature it will be. So it will detach from the tapeworm and will migrate to anus, and it will come out past the stool. So Taenia solium have an average of 1000 proglottids, and Taenia solium may produce 50,000 eggs per proglottid respectively. That is why the research say eggs can remain for up to 2 months in water, soil and vegetation, particularly in humid and warm environment. So they can be easily infect the animals as well as humans. So these are the comparison between cysticercosis and Taenia cyst. So cysticercosis, in a simple word, is an infection of human and pigs at larval stages. For Taenia cyst, an infection of human with adult tapeworm of Taenia solium. So for both of them, mode of transmission is quite different, where mode of transmission for cysticercosis is like you're consuming the contaminated food and water with the feces containing eggs, and the mode of transmission for Taenia cyst is like eating undercooked meat. Cysticerci in cysticercosis will not develop into adult worm, but they will migrate to multiple organs and tissue. But in Taenia cyst, cysticerci will develop into adult worm. The adult worm will attach to the intestine, and they will reside there for many years. So what are the clinical features? First is Taenia cyst. Taenia cyst is an infection within the intestine by adult tapeworms. So it is acquired by human by consuming undercooked pork or infected pork. They already contain the tapeworm or cysticerci. So the symptoms are abdominal pain, nausea, diarrhea and weight loss. Usually you have diarrhea and weight loss due to the worm is interrupting the absorption of nutrients. So that's why you used to have diarrhea, and you might lose weight because you're not enough of nutrients. So treatment. Parisaquantal will be given, where it's an anti-worm medication. Prevents the newly hatched larvae from growing and multiplying in our body. Nicosamide is an anti-helminth drug as well. So what are the prevention? So prevention, the first prevention is like we need to cook the meat properly so that there is no the parasite could not live in there because the meat is properly cooked. Then the second one is a meat inspection will be done, where the meat will be checked for the quality and the safe in consumption. Next is cysticercosis. It can happen anywhere in the body. That's why I said it will Once it can migrate to multiple organs and cause infection. So usually presented is seizures, where it's referred as neurocysticercosis. So anthroponosis is shared with human via fecal oral transmission. Also another word is like human to human infection through happens through fecal oral transmission. So clinical symptoms, signs and treatments usually asymptomatic. In the case of neurocysticercosis, blindness and presence of muscle cysts are seen. So people can undergo blindness and the cyst is present in their muscles. So what are the treatments? First, we have to give treatment for those who are suffering from seizures, which is anti-epileptic. It will decrease the reaction of the seizure. Next is kill the worm. So corticosteroid will be given. Why? It is to stop the inflammation made by the parasite. And also oral antihelmintic drugs will be given is to kill the worm present in the intestine. The same prevention as well. Proper sanitation must be done, where you have to properly dispose your feces, human feces, in a proper way. Then meat expansion will be done so that you can consume the meat in a safe way. Laboratory diagnosis for Taenia solium. So, stool examination will be done, where demonstration of characteristic of eggs and less often proglytoids of Taenia solium. So, multiple stool examination constellation technique will be done. Why multiple stool examination is done? Because once you're already infected with the parasite, it will take longer time for the eggs and proglytoids to be present in the stool examination. So they will do multiple stool examinations so they can detect the parasite. Also, the last one, anal swab. So eggs of Taenia saginata and Taenia solium are morphological the same, but we can identify Taenia saginata by doing Zell-Nelson staining because the eggs are acid fast. The eggs consist of oncosphere with 6 sucklets surrounded by embryophore. Proglotids of Taenia saginata and Taenia solium can be differentiated by lateral branches in uterus and expansion of segment. So for Taenia saginata, their branches in uterus are highly branched, but for Taenia solium is lateral branches. For expansion of segment in Taenia saginata is singly. For Taenia solium is in chains. Scolex can be detected in feces very rarely, but one important point that we can differentiate between Taenia solium and Taenia saginata is their Taenia solium scolex is armed with rostellum and hooklets, but Taenia saginata they don't have rostellum and hooklets. So as we can see, Taenia solium they have rostellum and hooklets, but Taenia saginata is absent. Their proglotids is like highly branched for Taenia saginata and lateral branch for Taenia solium. Their eggs are morphological the same, so it's very hard to differentiate. Another method we can do is ELISA. It is the best diagnosis because it's easier to differentiate between eggs of Taenia solium and Taenia saginata. As they are morphological the same, so it will detect the Taenia specific molecule in the feces. So it is 95% sensitivity and 99% specificity. So it's easier to differentiate Taenia solium and Taenia saginata. Last one is radio diagnosis. It's an imaging method. CT scan and MRI are two important imaging where you can identify cysticerca in the brain. For example, neurocysticercosis. So cysticerca is present in the brain. So it can be identified through CT scan and MRI. So what the result you can get from the CT scan and MRI? You can identify the number of cysts, the location of cysts, the size of cysts, and also the stage of disease. So this is the example. Here present one cystic lesion in neurocysticercosis. These are our references. Thank you very much.